And also, oddly enough, when this question about whether you nominate a liberal or not, or nominate somebody whose ideas are more progressive, if you had to identify the different candidates, since I'll just use the top three candidates. But if you, because I admit I'm leaving Dennis out, who is by far the most progressive candidate. I completely concede that. And if somebody supports Dennis, it's really hard to argue with you, except that he's not going to be president, and you know that, and so do I, and honestly, so does Dennis. But despite the fact that isn't it cute, he keeps saying the Kucinich administration. Every time he does, I say, "Oh, Dennis, that's so sweet." But anyway, you would assume that you would describe John's as the most progressive, and you would describe Senator Obama's as middle of the three, and you describe Senator Clinton's as the furthest to the right of those three candidates. Anybody who was making an objective evaluation would do that. But if you poll anywhere, they reverse Senator Clinton and John. Part of it is probably the way John talks, and they just make an assumption about where he must be because of the way he speaks. Partly is that he doesn't talk in language that's threatening. He describes policies in terms of their actual effect on people's lives, which sounds less threatening than some of the ways that, when he talks about universal health care, he doesn't talk about, obviously, about socialized medicine, and usually he talks about what the difference it makes in your individual life, how it is you're going to be able to go to the doctor, how it is your condition is going to be covered, and making it less frightening for people, I think. So it's partly an answer to your question, too. Yes.
Could you address that a little bit more for me?
What?
That's what I came, his policy on healthcare.
Okay.
And also, I feel like our health freedom is being impaired a lot, especially lately when Maryland, I don't know if you saw the article.
I live in a news-free zone, so you have to educate.
Sorry. Well,
no, it's okay.
Maryland, there was the governor that said if you don't bring in your kids to be vaccinated,
right.
they're going to be jailed. The parents are going to be jailed. Now,
I can't believe they really mean it.
Well, I watched that, and I think that's taking away from, these are our kids. They were not born to the state. They were born to us, and it's up to a parent to make that decision, as well as, down the line, whether you choose to have your child have chemotherapy or not, or go with alternative methods, that, the government will not come down on you as a bad mother, so to speak. I think that our health freedom is being impaired, and I see that all over. And I just want to know, first of all, what the healthcare system
Okay, I'll start with that. But I'm going to I'll get to what you have to say, because I think that sometimes when you're describing the healthcare program that John has, you don't actually get to the point you're raising here.
Okay, I want to know what his position is.
Absolutely. I promise to get to it, and hold me to it if I somehow forget that I'm supposed to go there too.
Okay.
John has a universal health care plan. It covers 100% of the people in this country. That means everybody has health insurance in this country. Your employers are required to provide it. Now, there are people who don't believe in using doctors at all. Christian Scientists and people who do not believe in that kind of intervention. But everybody is covered, because there are some conditions where you're having some communicable disease actually has an effect on people who might not be Christian Scientists and would like to make certain. We want to make certain that we have that kind of universal coverage. Also, universal coverage creates the actual existence of universal coverage creates some cost savings of the whole system that anything less than universal you don't actually get. So there's another reason to do it. Everybody's covered. If you are employed, your employer pays for your health insurance or pays into a fund based on payroll, into a fund that a percentage of their payroll that pays for health insurance. And I say that because it's pretty important. It means that if you're a 39.5-hour Walmart employee, they're paying on 39.5 hours. It does not help them not to hire you for 40 hours a week. So you quit playing that game about whether or not you're full time. It's based on payroll, not on employment status. Yeah, and so and this is going to apply to small businesses too, and I know that, there's some angst about that, because small businesses right now go in the market and they think, I can't possibly, I'd love to be able to provide insurance for my employees, because often small businesses have an even closer relationship with their employees and would like to be able to provide it, but it's too expensive. But one of the good things about this process is, because we are pooled all together, you don't have those small pools where you have the increased fees. They expect the cost of health care, and everybody who's done this analysis all expects the cost of health care to go down.
Yay.
As much as $2,500 health insurance to go down, health care to go down, and then health insurance to go down, about $2,500, making it more affordable for people. And the percentage of payroll is not so exorbitant that small businesses could not afford to pay it if they felt somehow that market was not friendly to them. Although there's no reason in the world it should operate anyway, except get the same deal that you get if you're GM, if you own mom and pops, in terms of insurance. If you're not covered, if you're not employed or whatever, then you would pay for your own insurance. But it's on a sliding scale. If you earn less than $100,000, the government will help subsidize your insurance. This is where part of the cost comes in, because I will tell you this is not free. So the government will help subsidize people so that it doesn't represent, nobody's health insurance represents more than 4 or 5% of their income. Right now it can be a lot more than that, but so trying to keep the cost down. So you get a subsidy, people will get subsidies. Providing those subsidies and the other cost-saving mechanisms that the government will do to create a universal health care system costs between $90 and $120 billion. Pretty expensive. Paid for by getting rid of the tax cut for people who make over $200,000. You get rid of that tax cut, the income from that will be directed precisely towards funding universal health care, which would honestly benefits not just the people who are getting the health care, but all of us. Because the people at the top, maybe they don't get the full amount of their savings, they're going to pay additional taxes, but they're also going to see savings. And if they're employers, they're going to see increases in productivity. For example, odd things like, it costs us $270 billion a year in lost productivity because of illness. Half of that is because of uninsured conditions that if they've been treated with it. So we'll see some other advantages that have seemingly nothing to do with health care. We're going to see advantages in education as students who are not getting the health treatment they need and therefore missing school or back in classes. So we're going to see these great ripple effects from universal health care. It will cover mental health. There'll be mental health parity. And I need to say something important about this, and also things like physical therapy and stuff like that will all be covered. Right now what you'll see, and those of you who've been through this will know this, so you have an injury and you need to get physical therapy, and your insurer says you get 3 sessions, and your physical therapist says you need 8 sessions.
Yeah.
It happens all the time.
All the time.
So in addition to universal health care, you need to pass a bill that John was actually a co-sponsor with McCain and Kennedy, the McCain, Kennedy, Edwards Patients' Bill of Rights, which meant that your treatment decisions are made by your doctor and you, and not by an insurance company. So if your doctor says you need 8, that's what you get. And the worst situations are in mental health treatments, even states that were in places where you have mental health coverage, there's just a certain amount that's allowed, and in physical therapy. Those are the 2 places you see the worst abuses. And this would, and so the Patients' Bill of Rights, in addition to doing a bunch of other things that are efficacious for all of us, it would solve that problem. So other things it covers pre-existing conditions. If you're going to have universal health care, it needs to cover the conditions people come to. Truthfully, health insurance policies all the time, they cover everything except what you got. And
Exactly.
And a health insurance policy that doesn't include cancer doesn't really help me much. I have a few other things, but nothing that really costs me very much. Cancer costs me a lot, and so we want to make certain that those pre-existing conditions are covered.